As conscious beings with the ability to reflect on our own experiences, we try to make sense of our lives and what happens to us. So the tendency to seek reasons for or identify the cause of our illness is quite natural, regardless of what that illness is. Because the precise cause of Parkinson's is not known, doctors cannot provide any casual explanations. Although many patients, when they hear the words, "You have Parkinson's," ask, "Why me?" And in order to attempt to answer this question has occupied clinical researchers for many years. So just because, as of right now, we don't know why one person develops Parkinson's and another does not, this does not stop most people with Parkinson's from searching for causes of their illness. Some people have told me that accepting the diagnosis would be easier if they just had someone or something to blame. Many folks with Parkinson's worry that any number of factors could have caused their illness. Let's take stress, for example. Some patients report experiencing some form of stress or trauma before the start of the illness, such as the loss of a loved one, undergoing an unwanted divorce, or loss of employment. But such events are also reported by people who suffer from other illnesses, so they cannot be considered as playing a significant role. Another common thought amongst those with Parkinson's, especially for those who have worked with a variety of different chemicals or toxins during their lifetime, are that those materials have caused their Parkinson's. The suggestion that an environmental toxic material, such as industrial pollutants, herbicides, and pesticides, may cause Parkinson's has led to a search of variations in prevalence in different parts of the world, as well as between rural and urban areas. But, once again, to date, no firm evidence has been offered from those studies. Furthermore, the fact that the prevalence of Parkinson's has not altered significantly during the last 100 years, and that it is not confined to areas of the world in which industrial or agricultural pollutants and toxins may be more prevalent, makes it unlikely that modern pollutants and herbicides is the culprit. Another popular myth about what caused an individual to develop Parkinson's is diet. After all, with the current emphasis on the importance of diet and the popularity of the idea that we are what we eat, it is not surprising that some people worry about the role diet may have played in causing their illness, and sometimes lead to feelings of guilt that somehow they brought this illness onto themselves. Well, if you're one of those people, then you need to give your head a shake, because unless you belonged to the native Chamorro Indian population on the Pacific island of Guam back in the early 1950s, and your diet contained at that time cycad seeds, then what you ate prior to your diagnosis of Parkinson's did not cause your illness. If you feel the need for more information on Chamorro Indians and cycad seeds, we can have a conversation about that another time. Just go with me on this one. Your diet did not play a part in the development of your Parkinson's. Think of it this way. People who eat the same food over long periods of time, such as husbands and wives, and people living in institutions, such as prisons, show rates of developing Parkinson's no higher than those in the general population. So, in summation, nothing you did and nothing you experienced and nothing you ate caused your Parkinson's. So, if your diet didn't play a part in your developing Parkinson's, does that mean that it doesn't matter what you eat and drink from here on in, because diet doesn't play or have any role in the management of your Parkinson's? The short answer to that question is no. Nutrition does matter. And now we need to look at why. If you pick up any book about Parkinson's and look at the chapter on nutrition and diet in Parkinson's, you'll see statements like, no specific dietary therapy is recommended for people who have Parkinson's. Or, if you have Parkinson's, there are no stringent restrictions as to what you should eat. Or, common sense is the best guide when it comes to nutrition and Parkinson's. Or, at the present time, there is no evidence to suggest that specific diets or supplements affect the progression of Parkinson's. So, if you take these statements at face value, you may decide to skip the rest of that chapter and think to yourself, I know nutrition won't cure my Parkinson's, and I know nutrition won't slow its progression, so I guess it's not important. Wrong. Regardless of whether you are newly diagnosed or in a more advanced stage of Parkinson's, it is very important for you to have a healthy diet. Some of you may be saying to yourselves, well, just what is a healthy diet? It is a well-balanced diet that includes adequate fiber and fluid to prevent constipation and enough calcium to maintain healthy bones. To me, these terms are just too general. What is fiber? What is adequate fiber? How much fiber and fluid should I take? What is enough calcium, and where do I get that? Over the next few minutes, I will attempt to answer these questions, but let's start with a document that you can easily get your hands on. Health Canada has an excellent booklet called Eating Well with Canada's Food Guide that gives sound advice for eating a well-balanced diet by consuming a variety of foods each day from the 4 basic food groups, which are meat and meat alternatives, vegetables and fruit, milk and milk products, and breads and cereals. You will get all the nutrients you need for good health from those 4 food groups. Some people ask for more details about the 4 food groups I've just mentioned. I think vegetables and fruit are pretty self-explanatory. They are high in fiber, which helps to deal with constipation. Other high-fiber foods are whole grain bread, bran cereals and muffins, beans and legumes. Dairy products include milk, yogurt, cheese, ice cream, which are all good sources of calcium, and meat and meat alternatives are red meat, poultry, fish, eggs, legumes, and nuts. Another reason why nutrition is of special importance for those with Parkinson's is because Parkinson's impacts so many different aspects of your health. It can slow the gastrointestinal tract, causing constipation, slow gastric emptying, as well as swallowing problems. Loss of sense of smell is often accompanied by loss of taste, which certainly impacts a person's interest in eating. Medications used to treat Parkinson's can cause nausea and loss of appetite. Not to mention the fact that levodopa, the most important medication for the treatment of Parkinson's, must compete with protein for absorption in the small intestine. I can almost hear you all saying, whoa, slow down, Sandy. Too much information to absorb in a short amount of time. Okay, sorry, I got carried away. It's just that Parkinson's changes everything, and not enough attention is paid to the impact that nutrition can have on your ability to deal with myriads of challenges that Parkinson's forces you to deal with. For example, along with all the motor and non-motor symptoms you encounter, did you know that people with Parkinson's are at an increased risk for malnutrition? I have to be honest and say that I really hadn't thought about this either, except for those in late or very advanced stages. But since I started doing my research for the chat today, I realized that this is an area I need to pay more attention to when I'm trying to educate people about how to live well with Parkinson's. By paying more attention to your diet, you can help to ward off nutrition-related diseases and even prevent hospitalization, something that I am sure you all want to do, given the disasters that can happen in a hospital because of the lack of staff education about Parkinson's, as well as lack of knowledge about the importance of the timing of your medications, etc., etc. Even though you may not have had a personal experience of being a person with Parkinson's in a hospital, I assure you it's not a place you want to be. And by following good nutrition practices, you are much more likely to stay healthy and avoid going to hospital. Just go with me on this one. So, what are these nutrition-related diseases that I referred to a few minutes ago, that if they become serious enough over time, can require hospitalization? These diseases include bone thinning, for example. Studies have shown that people with Parkinson's are at an increased risk for bone thinning. This is true for both men and women. Bone thinning simply means weak bones, which are prone to fracture. In other words, osteoporosis. Malnutrition, unplanned weight loss, and falls generally increase the risk for bone fracture. It's not a secret that as Parkinson's progresses, there is definitely an increased likelihood of falls. Therefore, it is very important to eat meals that provide bone-strengthening nutrients, particularly calcium, magnesium, as well as vitamin D and K. So, some good sources of calcium include milk and milk products such as yogurt, cheese, and fortified soy beverages, canned salmon with the bones, sardines, baked beans, tofu, almonds, green leafy vegetables, broccoli, dates, calcium-enriched orange juice. Calcium-enriched orange juice actually has 120 milligrams of the daily recommended value for your calcium. Most of the calcium we get in our diet comes from milk and milk products. So if you're unable to consume milk, or if you're having trouble eating full stop, you may need a calcium supplement. Please ask your doctor or your pharmacist to recommend one for you. Again, 120 milligrams of calcium is usually recommended daily for everybody. Another important thing to remember is that in order to absorb calcium, your body needs vitamin D. Although your body makes vitamin D naturally from sunshine, you can't count on the sun to provide your full daily requirement. The best food source of vitamin D is fortified milk. So if you don't drink milk, again, you should ask your doctor or your pharmacist about a supplement. 1,000 international units is the usual recommended dose for vitamin D. Along with calcium, vitamin D, and exposure to the sunlight, it is important to do weight-bearing exercises. The best one for that is walking. All of the above will keep your bones strong, help to prevent broken bones if you fall, and subsequently, and very importantly, prevent hospitalization. Another common problem that can lead to hospitalization is dehydration. Many people in general, and in particular those of you with Parkinson's, don't realize how important water is for health. Parkinson's medications can raise the risk for dehydration. Dehydration leads to confusion, weakness, balance problems, respiratory failure, kidney failure, and even in extreme cases, death. It is one of the most common reasons for admission to hospital in the Parkinson's population. An adequate amount of fluid, which by the way does not include coffee, tea, or alcoholic beverages because they will increase the risk of dehydration rather than prevent it, is at least 6 to 8 cups of fluid each day. It is important to keep a water bottle handy and take sips of water throughout the day. Parkinson's also slows the movement of your colon, which is a large muscle causing constipation. Water will also help you to be less constipated. So, speaking of constipation, of course, is a very common complaint among people with Parkinson's. Digestion is slowed not only by the disease itself, but also by because of some anti-Parkinson's medications, including your levodopa, that's your Sinemet or your Prolopa, lack of exercise, or not enough fiber in your diet. It is important to increase your fiber intake by eating fiber-rich foods, but it is very important to do this gradually, as too much fiber all at once can cause bloating and abdominal discomfort. Some good sources of fiber include whole grain muffins, crackers, and bread, high fiber cereals. The label should say it has at least 4 grams of fiber per serving. Dried beans, peas, and lentils. Bran. Try sprinkling a spoonful of bran flakes on your regular cereal in the morning. A lot of people find that very helpful. Dried flax. Again, sprinkle some on your regular cereal. Fruit and vegetables, including the skin, whenever possible, and dried fruits, such as raisins, prunes, and dates. Along with increasing your fiber, exercise also helps to keep your bowels regular. Even just walking around the house is okay, as long as you do it as often as possible. And don't forget that 6 or 8 glasses of fluid that you should be drinking. By the way, that's approximately 1.5 to 2 liters for those of you who prefer to keep track of your fluid intake that way. If you are using laxatives, such as Metamucil, for example, you must drink at least 8 cups or 2 liters of fluid each and every day. Otherwise, you might become even more constipated. And when you need to go, go. Never ignore the urge to have a bowel movement. You may need a stool softener or a stimulant laxative if constipation persists. Please talk to your doctor about this, as constipation is something that you definitely want to avoid at all costs. Uncontrolled and prolonged constipation can lead to a severe challenge called a bowel impaction, which makes it extra important for you to get enough fiber in your daily diet. If not dealt with properly, constipation can lead to a mass of dry, hard feces, which is impossible to pass normally. That's what I meant when I used the word bowel impaction. This is usually dealt with by going to the hospital and may require surgery. Again, something that you want to try to avoid at all costs. Unexplained weight loss can be a problem for many people with Parkinson's. The exact reason for this, unfortunately, is not understood. But there are a few things that can contribute to this, such as nausea from your medications, which of course is accompanied by a loss of appetite. Weight loss can be caused by dyskinesia. That's the excessive involuntary movements when you move too much instead of not enough. Side effect usually of your anti-Parkinson's medications. Depression makes people feel like they don't want to eat, and of course that contributes to weight loss. Also, it is common for people with advanced Parkinson's to lose weight despite even eating more. Again, not something well understood. Slowed body movements and difficulty feeding oneself independently means individuals often are not getting enough to eat because those who are feeding you, especially if you're in a hospital or in a long-term care setting, don't have the time that is required in order for you to eat sufficient amounts of food. Unplanned weight loss, along with malnutrition, can lead to a weakened immune system, as your body simply can't fight off infections and viruses the way it used to. It also leads to muscle wasting, loss of vital nutrients, and puts you at risk for other diseases. Some ways to improve your food intake include: eat and drink slowly. Eat small meals more often. Drink high-caloric foods like juices and milkshakes between your meals. Use foods that are easy to prepare to save your energy for eating. If you use up all your energy in the preparation of the food, when you sit down, you simply won't have the energy that it requires in order to be able to eat effectively. Get others to help you with food preparation, or consider services such as Meals on Wheels or other meal delivery programs. Eat what you like. It's okay to have breakfast at dinner time if that's what you fancy. Add butter, cream cheese, or sour cream to pasta, rice, potatoes, and vegetables whenever possible. Use regular fat milk products, cream, and whipping cream. Use of nutritional supplements such as Ensure and Boost may also be helpful. Eat high-caloric foods such as butter, mayonnaise, table cream, whipping cream, ice cream desserts, jam, custards and puddings, cookies. You know, all the things you've been trying to not eat all your life. Now that you're losing too much weight, go for it. Other tips for weight loss include: keep a record of your weight. Weigh yourself once a week. Eat when you have the most energy and when your medications are working well. Avoid filling up on low-calorie foods, and drinking tea, coffee, and clear soups can sometimes dampen one's appetite. So try to avoid those if you're losing too much weight too quickly. Save your appetite for the yummy things. Swallowing problems can lead to aspiration pneumonia, which is a common problem as Parkinson's progresses and often leads to hospitalization. People with Parkinson's who have swallowing problems often don't feel like eating, which again is one of those spirals in the domino effect. Because if you have swallowing problems, you don't feel like eating, which leads to malnutrition and a cascade of all of the complications I've already discussed today. Warning signs that there are swallowing issues include coughing or choking while eating or drinking, a gurgly voice, especially after eating, excessive chewing or drooling, delayed or an absent swallow, pocketing of food in the mouth. If you're noticing any of these things, the first thing you should do is talk to your doctor, who will, in turn, send you for a swallowing assessment by a trained swallowing therapist, usually a speech-language pathologist. Once this assessment is complete, you may receive a recommendation to alter the texture of the foods and liquids in your diet. You may need soft, minced, or even pureed foods and thickened liquids. You can meet all of your nutrition needs with an altered texture diet. If you are having problems chewing your food and are coughing now while you're waiting to see the doctor and have a swallowing assessment, you can start eating soft foods like cooked cereals, soft scrambled eggs, thick soups, ground meat, soft casseroles, anything where your food is minced to make it easier to swallow, because now you've actually changed the texture of the food. All of this may not sound very appetizing, but it sure beats the alternative of the possibility of choking. We get a lot of questions about the possibility of boosting your diet with supplements. Just 2 words about that. Exercise caution. Be cautious, very cautious, of things that are touted as being natural or herbal supplements. Natural does not necessarily mean safe, and even more important, it doesn't mean that it's necessarily better. Some supplements have been shown to cause side effects in some people taking medications for their Parkinson's. Again, it's important to discuss the use of any herbal supplement with your doctor before taking anything. Managing medication side effects is a very important aspect to your nutritional well-being. We are all aware that medications perform important roles in helping to manage Parkinson's symptoms. However, in some people, they have unwanted side effects that can have a huge impact on the nutrition of individuals with Parkinson's. Taking more than one medication increases the likelihood of those adverse effects. So it's a good idea to watch carefully for any changes upon starting a new medication. Also, many people with Parkinson's take drugs for other conditions, such as high blood pressure, high cholesterol. These drugs may also have undesirable side effects. Some common side effects of your Parkinson's medications include nausea, appetite loss after also being followed by weight loss, edema, that's when you retain fluid in your tissues and you have some swelling problems. Compulsive eating and weight gain can also be problems to affect your nutrition. If these unwanted side effects do occur, they occasionally occur at the beginning of drug therapy and decrease as you develop a tolerance to your medications. As most of you have heard me say time and time again, the best way to take your anti-Parkinson's medications, your levodopa, whether you're taking your Sinemet or Prolopa, is to take it on an empty stomach 30 minutes before a meal or 2 hours after a meal. That way you will get the most bang for your buck and the most benefit from the medications. There are some people, however, who simply cannot do that, and despite numerous efforts on their part, they cannot take their medications on an empty stomach because it continues to make them nauseated throughout the course of their disease. Severe nausea naturally leads to vomiting, which means not only can they not keep their pills down, they don't feel like eating either, which leads to other things that I've already discussed today, such as weight loss, malnutrition, and other serious problems. If you are one of these people who simply can't take your medications on an empty tummy, I suggest you try taking your medication with juice, crackers, cookies, or fruit. If the nausea still persists, I suggest you talk to your doctor about possibly adding a medication to your drug regime that will help with the nausea. This medication I'm referring to is called Domperidone. The other name for it is Motilium. Just to be clear, if you haven't listened to these chats before, you might think that I'm suggesting that you try drinking Domperidone, that very expensive champagne. No. I said Domperidone. That's a medication that should be taken for 30 to 45 minutes before your levodopa that will help combat the side effect of nausea. Of course, there is always the possibility that the nausea is not caused by your medication, so other possible causes need to be ruled out. After all, we can't blame Parkinson's for everything. The following suggestions may help reduce the nausea. Eat and drink slowly. Because of the slowness of movement, some individuals manage to eat only half of what was their normal amount in the course of a mealtime. So it is important to allow longer to finish meals and divide your servings into 2 portions. One can be kept warm in the oven while you're finishing the first portion. Eat small meals more frequently. Try drinking fluids between meals rather than with meals. Cold foods are sometimes tolerated better than hot foods. Eat what you want, when you want. If you take medication for nausea, such as Domperidone, take it on a regular basis. Do not wait for the nausea to happen before taking it. That's like closing the barn door after the horse has escaped. Sit upright after eating. Then, if necessary, have a rest at that time. But sit upright to allow your food to be digested more effectively. Try fresh lemon juice, mint, or ginger ale or ginger tea to help with digestion. Allow enough time to eat. Don't try to hurry your meals. So you're the last one to finish. There's no penalty for that. Finger foods or pre-cut foods are easier to deal with. Try to eat in a quiet setting so that you can relax between bites. Another factor that interferes with adequate nutrition is, believe it or not, your blood pressure. In particular, something called orthostatic hypotension. That's when your blood pressure suddenly drops when you go from a lying down to a sitting position, or more commonly, when you're going from a sitting to a standing position. The most common symptom of this orthostatic hypotension is dizziness or lightheadedness, but some people actually become confused. Some people develop a severe headache. They have shoulder and neck pain. If severe, some individuals actually black out and fall at this time. So what the heck does this have to do with nutrition? Just hang in there with me. I'm getting there. Orthostatic hypotension is part of Parkinson's process, as areas that normally increase blood pressure when we go from sitting to standing deteriorate in those with Parkinson's. So, blood pressure does not regulate itself automatically in some people. Not enough blood gets pumped up to the brain, and bingo, you feel dizzy and are at risk for falls when you stand up too quickly. So, now for the explanation about how low blood pressure and meals are connected. Sometimes fainting from low blood pressure can be confused with sleep, and the following scenario is one we often hear from our clients. Mrs. Smith called to say that her husband with Parkinson's frequently falls asleep after or even during his meals. He just slumps over and sleeps with his head on the table, and I have an awful time trying to wake him up. These symptoms are really beginning to interfere with his nutrition, and he's often not able to finish his meals. Why is this happening? So, understanding that while sudden drops in blood pressure are part and parcel of Parkinson's itself for some people, certain medications like Sinemet can lower your blood pressure too. And, as you know, we encourage folks to take their pills at least 30 minutes before the meal. So now we have Parkinson's that lowers blood pressure and medications that do that as well. And if that's not enough, there's something else going on in this scenario too. Meals always tend to drop people's blood pressure too, because during meals, blood tends to get diverted to the stomach to help with digestion. And blood pressure, therefore, is involved in circulating blood and rerouting it back into the circulatory system and up to the brain. So, in actual fact, what Mrs. Smith is describing as sleep attacks during meals might actually be fainting spells. At the end of the day, these faints need to be addressed, as Mr. Smith is at risk for falling, plus he's not getting adequate nutrition if he's fainting in his porridge, soup, and mashed potatoes. So again, orthostatic hypotension can be evident at mealtime and during meals as well, and should not be mistaken for falling asleep in your soup. The first thing Mrs. Smith needs to do is to report what is happening to her doctor. Second, Mr. Smith's blood pressure should be taken as soon as this happens to provide the answer as to what's going on. Medication may need to be prescribed, but some first steps that can be taken are either eating smaller meals more often. Increase your salt intake, as salt retains water, and that will help to stabilize blood pressure. Increase your fluid intake. A movement disorder specialist once told me that if any of his patients have issues with drops in blood pressure, sudden drops in blood pressure, he gets them to drink at least 4 glasses of water in the morning before their feet even hit the floor in order to keep their blood volume up throughout the day. Maybe something you want to give some consideration to if your blood pressure is fluctuating and dropping rapidly throughout the day. Cutting down on your sugar intake can sometimes be helpful. Decrease or limit your alcohol might help too. But before doing any of these things I have just mentioned, be sure, please, 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 to talk with your doctor, as increasing your salt intake may be contraindicated for you if, for example, you have heart disease. Now, last but not least, I'm going to deal with that age-old question that we hear on a regular basis. I've heard that I shouldn't take my medication with protein. Is that true? If it is true, then why shouldn't I? Let's go back to the drawing board for a minute. Levodopa, that's Sinemet and carbidopa, or levodopa with benserazide, that's Prolopa, are the gold standards when it comes to the treatment of Parkinson's. Sounds fairly straightforward, doesn't it? Just take some medications for symptom control, and that's all there is to it. Wish it was that easy, folks, but unfortunately, no such luck. There are some barriers to the absorption of those medications by the body. And hopefully, if you have a better understanding of what the barriers are, the result will be that you'll get the best possible benefit from your medication. Barrier number 1. If you take your Sinemet with a meal, or just after a meal, it may take a very long time for the Sinemet to be absorbed. This is because the stomach takes about 1 to 3 hours to empty itself after eating food. Therefore, if Sinemet is mixed with food, it takes the same amount of time to clear the stomach as the food does. I can't imagine that any of you would want to take 1 to 3 hours for your Cinemet to get into your small intestine, let alone for it to take hours to get into your bloodstream and then up to your brain, where it will start sending messages to your muscles in order for you to move in a smooth, coordinated, controlled and spontaneous way. One reason to take your medication on an empty stomach. Barrier number 2. A high-fat meal takes even longer to clear the stomach. Fat is digested very slowly compared to carbohydrates and proteins. If Cinemet is taken with a high-fat meal, it is further delayed in clearing the stomach. Once again, take your meds on an empty stomach. Barrier number 3. Protein in food is broken down in the intestine into something called an amino acid. These amino acids have to travel across the wall of the small intestine in order to get into the blood. Then they must travel and get across the blood-brain barrier in order to enter the brain. So, guess what? Cinemet also has to transit the small intestine and the blood-brain barrier using exactly the same carrier system as the amino acids. I am sure you can all understand that now there is a big competition between protein and Cinemet to see who can get to the brain first. Well, you get it. The protein food in the food always wins the battle, and poor old Cinemet loses out. Let me take another crack at explaining this because it's a very important point. Most meals contain a large amount of protein, and the amino acids from the protein in the food use up all the carriers. In other words, they create a traffic jam, and they clog all the highways to the bloodstream for hours on end. Therefore, in order to get into the bloodstream, the Cinemet must wait until these carriers, or highways, are free again, and the traffic jam has cleared. The same thing happens when Cinemet tries to get into the brain in order to get to where it does its best work. Once more, those pesky amino acids from protein in the food clog up all those highways, and poor old Cinemet doesn't get to work in the timely fashion you'd like it to. Now can you see why we are always stressing the importance of taking your medications at least 30 to 60 minutes before eating a meal? You need to give it a head start so that it has the opportunity to have clear sailing in order to get into the brain and give you the symptom relief you want and deserve. I am very aware that once you've had to increase the number of times per day that you take medication, it's very difficult to always take your Cinemet 30 or 60 minutes before a meal. Just do the best you can. That's all anybody can ask of you. So just a quick FYI. Meat, fish, poultry, milk, cheese, eggs, these are all foods that are very high in protein. So, there are a few more tips about how you can make mealtimes easier. Slowness or stiffness can make it very difficult to prepare and eat nutritious meals. You may also find it takes a long time to complete a meal. Try eating small portions on a small plate that you can fill again on a regular basis. When dining in the company of others, cut your food in advance, or ask the kitchen staff if you're in a restaurant to cut your meat before they bring it to the table. Before going out to large family outings, you may want to eat quietly at home first, thus reducing the need to eat adequately while you're trying to enjoy yourself. Frozen meals and meal delivery programs may be useful if you're having problems preparing your own meals. Again, it's all about having enough energy to be able to eat. Dyskinesias may make it difficult to eat independently, and they also increase the amount of energy that your body needs. This can be a barrier to getting adequate nutrition. Again, small, frequent meals, high caloric foods, and nutritional supplements such as Ensure or Boost can improve your food intake. Don't forget finger foods. Also, there are special utensils and two-handled mugs with lids that may make eating these easier. Good nutrition is essential to help you maintain your best level of health. A consultation with a registered dietitian could also be helpful. Now, I know we're getting to the end of our chat today, and I have to take a little drink of water. Okay. I have had a question from a client who is asking how to manage diverticulitis and pain. So, diverticulitis are small, bulging pouches that can form in the lining of your digestive system. They are found most often in the lower part of the large intestine or your colon. These are common, especially after the age of 40, and the good news is they seldom cause problems. Sometimes, however, one or more of the pouches can become inflamed or infected. That is the condition that we're referring to today. That's diverticulitis. It can cause severe abdominal pain, fever, nausea, and a marked change in your bowel habits. So if indeed this is something that you are experiencing, it may have absolutely nothing to do as far as your Parkinson's is concerned, but it may indeed be exacerbated or made worse by your Parkinson's. So again, because some bowel symptoms are related to Parkinson's, and the same thing may also be caused to make your diverticulitis worse, it is important to discuss your issues with your specialist to sort out what conditions is causing what symptoms. Symptom management tips include exercise, fluid intake, increased fiber, etc., because all of those things will help both conditions. So if the person who wrote this question would like more information about managing diverticulitis, as it may or may not relate to Parkinson's or may be exacerbated by the Parkinson's, please give me a call at 416-227-3375, or you could write your email to my director. That's Debbie Davis. So that's DEBBIE.Davis, DAVIS, at Parkinson.ca. So please don't hesitate to write and or call, and we'll have a further discussion about this particular issue. So that's it for today. It's now 1 o'clock. July's talk, lunchtime chat, will be on various forms of communication, and I'm not just referring to voice and speech issues for people with Parkinson's. I'm referring to communication in general. So I hope you'll tune in then so I can communicate about communication. Take care, everyone. Have a great month. See you in July, and bye for now.